Hi, it's Callum. So this is the last in our uh, in this series of videos. We're looking at the endometrium, and this is shedding or menstrual phase endometrium, which is day 1 to 5 of the uh, ovarian cycle. So hopefully you'd agree at low power here looks quite different from the last two videos. We've got it's mostly red, which is reflecting the fact this is mostly blood. We've got, and interspersed with that, we've got this pink stuff, which is fibrin, and also clumps, dark blue clumps of cells that don't have the structure. They don't have that nice tubular structure with the proliferating phase. They don't have the serrated or tortuous dilated glands of the secretory phase. We've kind of got a structureless biopsy with lots of blood, and so we're already thinking this is probably, with blue clumps that don't have structure, we're thinking this is probably menstrual phase. But let's have a look and confirm that. So if we have a close-up, we can see, yeah, so we've got blood here, which has got this sort of pink, light pink material through it. So this is fibrin. So this is just essentially a blood clot with lots of acute inflammatory cells. These are neutrophils interspersed among it. And interspersed with all of this, we've got these clumps, dark blue clumps of cells. These are probably were stromal cells, which are dying off, losing their structure. We can't see the glands within these. These are just cells that are dying off because physiologically the endometrium has become ischemic, and the endometrium is dying off, and that's what it looks like when it does that. So you get these amorphous clumps of hyperchromatic cells, blood, fibrin, clot, neutrophils, and that's what menstrual phase endometrium looks like. So context is important in pathology. If I describe these as out of context as hyperchromatic dark cells with high nuclear to cytoplasmic ratio, loss of the normal structure, you might be forgiven for thinking that I was describing malignancy. But we've got to remember that the context here is this is an endometrial biopsy. We've probably got a bit of history that came with that in terms of what point during the cycle, which day of the cycle when the clinician took the history, they hopefully will have included that information within the histology request or the pathology request. So we've got that information. We can put that together and be happy that this is not in fact malignancy. This is menstrual phase or shedding phase endometrium. Okay, we're going to finish off with a video looking at the histology of the cervix, and that will conclude our quick run through gynae pathology. Okay, so speak to you soon.